So your inner thighs are itchy, maybe even burning a little, and you've googled enough to convince yourself that you're dying. Let's clear this up real quick. You probably just have a jock itch, and I've seen this more times than I can count. It is annoying, yes, but very treatable. Today, I'm going to walk you through exactly what causes it, how to get rid of it, and how to keep it from coming back. So, picture this scenario. Let's imagine a guy called Marcus, 28 years old, a fitness enthusiast who recently started working out twice a day. He's been living in compression shorts and barely gives himself time to dry off after he showers. A week later, he notices a red patch on his inner thigh with intense burning, itching, maybe even some flaking of the skin. That's called jock itch. That's textbook jock itch. And he's not alone. Guys, especially between their teens and 40s, are prime targets. However, it affects everyone, but it is uncommon in women. Actually, men are 3 times more likely to get it than women. You also may be more prone if you have diabetes, if you're obese, or you have a weakened immune system. So what is jock itch? Jock itch, also called Tinea Cruris, is a prevalent fungal infection, really common. Some people refer to it as a ringworm affecting the groin due to its shape, even though a worm doesn't cause it. Tinea is another name for ringworm, and Cruris refers to the groin area. These are members of the same family of fungus that causes athlete's foot, and it loves warm, damp places like your groin after a workout or if you sit in sweat-soaked clothes for too long. Typically, it starts in the creases of your thighs and it spreads outward in like a ring-like rash, which is why we call it ringworm. It affects the skin around your groin, inner thighs, and butt crack, but it spares the actual genitals. Some common signs are itching, burning, red scaly edges, and sometimes you can notice some peeling or flaking of the skin. So what causes it? Direct skin to skin contact or contact with an infected surface. It's really contagious. You can also get it through intercourse if your partner is infected through skin to skin contact. So yes, you can also get it if you're someone that sweats a lot, you wear tight clothes, you have poor drying habits, you share towels and clothes, and sometimes through having an athlete's foot, which actually travels north when you put on your underwear. And here's a tip. If you've ever had athlete's foot and now you notice that you have a groin rash, please treat both of them. These fungus are really sneaky and they can move. So how do you treat it? Here's where most guys mess up. They try the steroid cream alone. Please don't do that. That can make it worse. Also, if you decide to wait for it to go away on its own, that's not going to work. And if it's left untreated, it can spread to other parts of your body like your hair, your hands, and your feet. One recommended option is over-the-counter antifungals. You could look out for clotrimazole, also called Lotrimin, miconazole, terbinafine. You can have the cream or the powder. Apply it once or twice a day for about 2 to 4 weeks. But even if it looks better after a few days, don't stop. Keep going, because stopping early is how it can come back stronger. The second option is prescription medication. So if the over-the-counter stuff doesn't work, please see your doctor. Oral antifungals like terbinafine, fluconazole will knock it out fast, especially if it's widespread or if it keeps coming back. So some people might ask about natural remedies that could be effective against jock itch. There are a few of them, but we'll touch on essential oils, which may help prevent or treat jock itch. Oils like tea tree oil can prevent or stop the growth of bacteria, and also for fungi, it kind of works, but it should be diluted, not direct, as it can irritate your skin. If you are allergic to essential oils, please avoid them, but know that none of these natural methods actually beat real antifungal medication. Now, let's talk about prevention, because nobody wants to deal with this a second time. The first one is to keep your groin dry. After showering or working out, dry yourself thoroughly. And additionally, if you're getting treated for a faster recovery, keep that area clean, dry, and cool. You could also use a separate towel to dry your infected areas after you shower, or if you have only one towel, dry the infected areas last. Next one is to change out of your sweaty clothes fast. Don't chill in your compression shorts after working out or while you're sweating. Make sure you wash your clothes after use. Now, avoid wearing tight underwear or pants. Try to wear loose underwear and pants that actually allow that area to breathe. You can try cotton or moisture-wicking fabrics. Those are preferable. Antifungal powders are also effective for those that sweat a lot. It could help absorb moisture, help keep that area dry. Next, treat your athlete's foot at the same time. Not treat one then the other. Treat both at the same time, no shortcuts. And also, do not share towels or clothes with others. This fungus is really contagious. Now, If you have symptoms, avoid scratching your groin because scratching that area may cause the fungus to spread to other parts of your body. And finally, avoid sexual contact with anyone who has a jock itch until it's gone. So here's the quick tip. If you have athlete's foot, put on socks before you put on your underwear. This will keep the fungus from coming into contact with your underwear and spreading upwards. Now, when should you see a doctor for a jock itch? If the rash hasn't improved in 2 weeks, even with consistent treatment, or it looks infected or it's spreading, please get it checked. It could be resistant or it could be something else entirely, like eczema, yeast, or something worse. Listen, jock itch is annoying. It's unpleasant, but it's not dangerous if you treat it early. Don't be embarrassed. Most guys get it at some point. It's really common, especially if you're active. What matters is knowing what it is and knocking it out fast. Now, here's the part nobody really talks about. What if that groin rash isn't jock itch at all? What if it's something more serious? I've seen people misdiagnose, sexually transmitted infections, yeast infections, or even skin cancer as just a fungal infection. In the next video, I'll show you 5 skin infections that can look just like jock itch, but require completely different treatments. And you do not want to ignore number 3. Now, if you watched this to the end, hit like if you've learned something new, or if it was helpful. Drop a comment if you've ever had to deal with this, or if you have any other questions. And as always, subscribe if you want more reliable health tips from TheWhizDoc. Stay itch free, and I'll see you in the next one.